In the middle of the pandemic, when patients across the country were putting off cancer treatment, delaying potentially life-saving medicine, we reimagined cancer care. Today, our patients with breast cancer, prostate cancer, and lymphoma routinely get safe and effective treatment in the comfort of their own homes. Penn Medicine provides world-class cancer care to more than 17,000 new patients each year. Most cancer treatment happens in the clinic or the hospital. This is just how it's been in cancer care across the country for decades. And so we asked, why?
I called it my calendar killer. As a breast cancer survivor, every month for 5 years, I had to make my way over to Penn, all for a shot that takes a couple of seconds. I had to work my life around that shot.
We knew we could do better, but change on this scale is never simple. We needed the right team.
We've been administering medicines at home for over 2 decades, but this was the first time we had tried to bring cancer treatment home to such an extent. We involved a nimble group of people from across the health system: doctors, nurses, pharmacists, and innovators, and empowered them to make change happen fast.
Together, we made decisions based on the facts. Internationally, giving cancer drugs at home has been done safely and effectively, but it's uncommon in the US, even though the research shows that patients and caregivers prefer it.
We knew there would be challenges, but we also knew we could do it. We had the expertise to implement the program with the utmost attention to safety for patients and for our staff.
We talked about not whether cancer care at home was safe, but how to ensure it was. Not whether to shift treatment from the clinic to home, but which treatments and for which patients. We spoke with patients, caregivers, clinicians, pharmacists, and administrators. We listened to their concerns and systematically addressed them.
The important thing is that our patients' own oncologists order the cancer treatments we administer at home, and oncology-certified nurses give the injections and infusions at home using safety and quality protocols that match what patients would experience in the hospital or clinical setting.
The first time I heard the nurse ring the doorbell, I was a little nervous. The shot had been delivered to my house, and Penn called me to schedule the day before. The nurses are so kind and always explain everything they're doing. They mix up the leuprolide shot and ask me if I'm ready. They then administer the shot to my lower hip. The shots do sting, but the nurses always ask if I'm okay or say I'm sorry. I know it burns. To me, it's the little things like this that set Penn apart. The nurses are compassionate and they care. It's at most a 15 to 20-minute process, start to finish.
The response was awesome. During the first month of the program, we referred 39 patients to receive treatment at home. We got rave reviews. Patients were thrilled to get safe and effective cancer treatment at home. And clinicians deeply appreciated the quality of the care provided.
The COVID-19 pandemic added great urgency and alignment on mission, but we were ready. When stay-at-home orders were issued, we were prepared and scaled the program in just a few weeks. In 1 month, we saw nearly 700% increase in the number of patients participating.
Today, we have redirected hundreds of patient visits from our clinics and hospitals to patient homes while maintaining timely, safe, and effective cancer treatment during the pandemic. And when the pandemic is over, cancer care at home is here to stay. For patients like Miss Desiree Harmon, it means 12 fewer trips to the hospital every year.
It's truly night and day from the hassle it was before, and it could not be easier. As you know, I was kind of freaked out about COVID-19 because I have a compromised immune system. I'm so grateful to be a part of the program.
This is a group of people who put patients first and go the extra mile. We're already working on what's next, ready to keep improving care for patients with cancer.
It's now time to make cancer care at home available to more patients across the country.
Getting my cancer care at home is the best. I never want to go back.